Thank you, Paul, and thank you for the update. And always a pleasure to see Terence, not least at these events in terms of promoting sepsis. And Bernadette, just to say thank you for sharing that very personal experience. I think it's really important that people understand that although, of course, we're looking at things through a clinical lens, it's about the patient and the family impact. And I think that was very brave to do what you did. So thank you very much for sharing that as well. My role actually is to be here to mark the day with you. I have just come from the event which is taking place elsewhere in Cardiff, just marking World Sepsis Day in terms of ensuring that we have an awareness, not just in terms of what you're up to in Cardiff, and I'm very grateful for the visibility and the scale actually of what you are doing in Cardiff, but to ensure actually that we are learning lessons and promoting this awareness as a country and across all of our respective health organisations in Wales. And I was just proud actually to see the way in which staff had embraced this at the event earlier on today. And just as I walked in here, I didn't know how many people I'd be expecting you to be gathering, Paul, to just have the sense of awareness. But just great to see so many of you prepared to give up your time this afternoon and understand what it means for us to be much more proactive in this space, because we can genuinely make a difference. I think as a country, we've taken this area this very important area forward just really by trying to focus some of our national resources as well as, I know, local efforts to make sure that this awareness is there. And I think we have had some acknowledgement about what we've tried to do, as I said, by not just looking at this only as an individual organisation, but trying to have a national approach throughout the whole of Wales. And I do think that we are fortunate that we've been able to use some of our national improvement resources, for example, the Rails programme, which is overseen by the 1,000 Lives mechanisms that we have in place to try and bring together these experiences, and they were very visible earlier. But it's really important that every organisation brings its own efforts and actions to the table as well. I just wanted to acknowledge actually what you're up to in Cardiff and Vale. Again, although I've known Paul and Gemma over many years actually, because I used to work in Cardiff myself over 12 years or so ago now. But actually the fact that Cardiff has really embraced this, has gone at it. And I even remember as I started 3 years ago, Paul, you getting me to one of your events just in the foyer of the main entrance, just again to promote the awareness. So I know this has been a very consistent expectation. I think whenever we're trying to improve our system, it's never easy to do so, but it's important that we can try and do that with some consistency and some methodologies. And again, speaking about the event this morning, just to see that people were genuinely tracking their performance, they were monitoring, and they were using the data to know actually that they were making a difference in terms of both the compliance, but actually in terms of knowing that they were avoiding deaths and difficult and tragic circumstances for patients and their families as well. There is a real hospital focus on what we're doing across Wales, inevitably. If you look at the emergence of this, obviously the interest of the intensivists, the interests of those working in emergency medicine in particular. But I think as we look forward in Wales, there's also an opportunity, given that we run a planned system which involves all of our services and all of our different settings. That is the function of our different health boards, is to make sure that we can also look at sepsis and its prevalence and the signs and symptoms actually in the broader setting around community and primary care settings as well. And I would really ask that you work on that, as well as obviously receiving patients into our acute setting in the hospital side, that I think we can also look at this from a system perspective. And I think it's really important that we acknowledge that we have a responsibility to those individuals and their families who sadly have suffered the consequences of sepsis, and really have a greater focus on the aftercare and the support that needs to be provided in these kind of arrangements. And although I know you wouldn't have all been there this morning, the Cabinet Secretary was speaking, and some of you were at the event, I know from the Cardiff perspective, was just announcing earlier today a collaborative project that's being planned, which includes the UK Sepsis Trust, the Rails programme, and the 1,000 Lives Educating Patient programme, just aimed at offering support to people with post-sepsis syndrome. And I know that you would want to play a full part in contributing to this important development. And I have to say, not least, just emphasised really by Bennett's words on behalf of the family earlier as well. So I think today, as World Sepsis Day, it's a day to take stock, and I think it's really important that we focus on the really good work to date, but obviously to make sure that we can focus on what more we can do in the future. And I would just like to say to you, and particularly knowing that Cardiff has been a lead and an advocate in this as well, to say a very well done to you and thank you in advance for the contributions that I know I can rely on you all to continue to make. But you can genuinely, as staff, make a difference in this arena, and we can genuinely make a difference actually to the services and the response that we discharge on behalf of the population of Wales. So, Paul, a great pleasure that you've asked me to be up here and to just contribute to your local session as well as having the national programme earlier, and please keep up all of the good work. So thank you all very much for listening, and I'll hand back to Paul. Thank you.